Thank you. Mr. Anthony Harris, Director of Medical Services of the Queen Elizabeth Hospital. Mrs. Colette Delaney, Chief Executive Officer, CIBC First Caribbean International Bank. Mrs. Roseanne Myers, President of Keratoconus Barbados. Dr. Sherwin Benskin, Head of the Department of Ophthalmology, Queen Elizabeth Hospital. Mr. Nigel Barker, Consultant, Department of Ophthalmology, Queen Elizabeth Hospital. Specially invited guests, members of staff of the Ministry of Health and Wellness, the Queen Elizabeth Hospital, CIBC First Caribbean and Keratoconus Barbados, members of the media, ladies and gentlemen, a pleasant good morning. See, I don't get the opportunity to be able to say protocol having been established because it is expected that the minister will do that. But honestly, it was about a year ago that Roseanne came to my office to speak to me on this subject, keratoconus. And although she did a very good job in trying to explain to me what it was all about, I actually had to go and Google it afterwards because it was something really new for me. Anyway, it is my pleasure as the Minister of Health and Wellness to address you this morning as we acknowledge this fantastic showing of good social responsibility by the First Caribbean Trust Foundation, which is the charitable arm of CIBC First Caribbean International, which has donated to the QEH its first ever Pentacam tomography machine on behalf of Keratoconus Barbados. As a public health care provider, the QEH is establishing centers of excellence in certain specialist areas of care, one of which is ophthalmology. I am pleased to state that the Department of Ophthalmology of the QEH is the only eye care facility of its kind within the Caribbean and has garnered a stellar reputation for the delivery of superior care to its patients. Presently, the department provides specialist care in pediatric, glaucoma, neurosurgical, and oculoplastics care, which makes it the only eye care facility in the region to offer this range of specialized ophthalmic care. And I think that this is something that we in this country should really be proud of. Based on international trends, it is estimated that the ideal number of ophthalmologists per 100,000 population should be 5. Well, this means for us that the QAH has the human resources to meet the eye care needs of all Barbadians. However, to further meet the population's need for greater access to ophthalmic care, the QAH commissioned the refurbishment of the outpatient clinic in the Department of Ophthalmology. This renovation costs approximately $6 million Barbados dollars and expanded the physical capacity of the eye clinic. On average, the outpatient clinic now sees in excess of 20,000 patients per annum, and this number continues to grow. In 2015, the department saw a record-breaking 26,161 patients and performed 1,654 surgeries. In keeping with its dedication to excellence in patient care, in January 2017, the department commenced the Cataract Initiative. The aim of this initiative was to reduce the backlog of approximately 500 patients on the waiting list for cataract surgery. And between January and July 2017, a total of 537 previously waitlisted surgeries were completed. However, although the QEH has the capacity in regards to specialists, trained ophthalmic care providers, and improved outpatient facilities, there are a number of factors which continue to contribute to preventable blindness in Barbados. Based on information provided by the World Health Organization, glaucoma is the second most common cause of blindness worldwide. It is estimated that 4.5 million people globally are blind due to glaucoma, and that figure is expected to rise to 11.2 million by the year 2050. In addition to glaucoma, cataract remains the leading cause of blindness globally, and diabetes is becoming increasingly common around the world as a risk factor, including the Caribbean and by extension here in Barbados. As the prevalence of diabetes increases in our population, and it is currently estimated at 17% of the adult population, so do complications which affect the eyes. These complications include cataract, diabetic retinopathy, and neovascular glaucoma. The 2017 International Diabetes Foundation Diabetes Atlas reported that the prevalence of diabetes in people aged 24 to 79 years in Barbados was 17.6%, diagnosed with 26.2% in total, which means that approximately 9% of cases going undiagnosed. The research indicates that approximately 1/3 of persons living with diabetes in the Caribbean are affected by eye disease. The Ministry of Health and Wellness, through a collaborative process that included public and private sectors, developed the National Eye Care Policy and Strategic Plan 2014 to 2019. The goal of this policy has been to provide a framework for the elimination of avoidable blindness and visual impairment, a commitment Barbados made when it adopted the Vision 2020 goals. Overall, the desired outcome is to strengthen the delivery of ophthalmological services at the primary, secondary, and tertiary levels of the healthcare system. The Ministry of Health and Wellness will continue to build a healthcare system that addresses the promotional, preventative, curative, and rehabilitative aspects of eye care while engaging the public by providing information to raise awareness of preventable causes of blindness and visual impairment. This remains a priority, and we welcome sustained strategic partnerships such as that established between the QEH, CIBC First Caribbean, and Carrickfergus Barbados, which will bring us this much closer to obtaining the Vision 2020 goals. To this end, on behalf of the Ministry of Health and Wellness, the board, management, staff, and patients of the QEH, I express sincere thanks to CIBC First Caribbean and Carrickfergus Barbados for the timely donation and the wonderful work which Carrickfergus Barbados is doing to raise awareness in Barbados. In closing, the problem of preventable blindness is not unique to Barbados or the Caribbean, but it is one of global proportions. As such, I hope that through the donation of this Pentacam tomography machine, we can begin to better diagnose those afflicted by keratoconus and provide them with the ophthalmic care they desperately need. So thank you very much on behalf of a very grateful hospital and a grateful nation, ma'am.